Rat's blood sample. In biomedical research, rats are the preferred species, and in most of the experiments we need to take or collect blood samples from rats. The first question here: how much blood does a rat have? The total blood volume of a rat is about 7 to 10% of its total body weight. So, normal adult rat weighing 200 to 400 grams have 20 to 40 milliliter of blood. And the maximum volume from a single blood sample collection should never exceed 10% of the rat's total blood volume, approximately 2 to 3 milliliter. Exsanguination volume of blood in this rat is about 8 to 12 milliliter of blood. Sampling frequency versus volume. If blood sample is collected every 2 weeks, so the maximum volume can be collected in this case is about 10% of animal total blood volume. In other words, never exceed 1% of animal body weight if you collect blood every 2 weeks. But if you collect blood every 4 weeks or less intervals, you can take only less than 15% of animal total blood volume. Look here, this is a table that shows the NIH guidelines for approximate blood sample volumes for a range of body weights. For example, if we have a rat weighing 200 grams, the total circulatory blood volume is about 11 to 14 milliliter, and the blood sample collected every 2 weeks never exceed 10% of the total blood volume, about 1.1 to 1.4 milliliter per time, so as to avoid death, hypovolemia, and death of the rat. Again, this is a table adapted from Handbook of Laboratory Animal Management, 3rd edition, showing mouse and rat total blood volume in normal adult and safe volume from single blood collection, and classified according male or female. It is necessary that blood sample collection is done by a well-trained individuals so as to minimize the stress and other physiological reactions in the animals in which may have impact on the results and parameters under study. Also, to minimize the stress, most of blood collection methods we will mention and discussed are performed under anesthesia. This table shows commonly recommended anesthetic agents for rats and mice and the doses. Look here, we can use short-term anesthesia by inhalation of isoflurane, halocene, or ether. But if you want intermediate and long-term anesthesia, we can use ketamine and uricane. This is a dose of uricane for long anesthesia, 1,200 milligram per kg injected intraperitoneal. What are the methods of blood collection in rats? The sample can be collected either by terminal and non-terminal. Terminal method, here the animal will not recover and will die after the method, while non-terminal, the animal will recover. If it is decided to use non-terminal method, the maximum blood volume collected should never exceed 10% of animal total body blood volume, or in other words, never exceed 1% of body weight, so as to avoid hypovolemia and death of the animal. This is according to NIH guidelines. We have 5 common methods for collecting blood samples that will be discussed in this presentation. First is the orbital sinus blood collection. This can be used as terminal or non-terminal according to the blood volume collected. Second is cardiac puncture blood collection. This is terminal. Decapitation is also terminal. While tail vein blood collection and saphenous vein blood collection are non-terminal methods because we collect small volume of the blood. How to decide on the most appropriate blood sampling technique for a rat? This depends on 2 factors. Number 1, do you require more than 1 blood sample? You need frequent blood sampling? If yes, this depends on the frequency. The volume will depend on the frequency. If you collect every 2 weeks, you can take less than 10% of the total blood volume. If you collect every 4 weeks or less frequency, you can collect less than 15% of total blood volume. But if you collect blood every 24 hours, you should take less than 1% of total blood volume, which is about 0.25 milliliter. If no, I need just 1 blood sample, not frequent sampling. In this way, you can use terminal or non-terminal method. In non-terminal method, the maximum blood volume collected less than 10% of total blood volume, so as to avoid hypovolemia and death. While in terminal, you can collect unrestricted volume, and here you need general anesthesia. The second factor, how much blood do you require to collect? If you wanted to collect small volume, here you can use general anesthesia or without general anesthesia according to the procedure needed. Saphenous vein and tail vein collect small volume of blood, can use with or without anesthesia, while retroorbital need anesthesia. But if you want large volume, more than 3 milliliter in one collection, here you need terminal techniques, and of course you need general anesthesia before the technique, like cardiac puncture, retroorbital terminal, and decapitation. We will discuss the 5 methods of blood collection. First, orbital sinus blood sample collection. Orbital sinus blood sample collection. It is used as terminal or non-terminal method. This according to the volume of blood collected. If you wanted to collect small volume less than 3 centimeter, so this method is non-terminal. While if you wanted to collect large volume of blood, more than 3 milliliter, you can use this method as a terminal method. Blood here is collected from retroorbital sinus using standard heparinized capillary tubes. Steps of orbital sinus blood sample collection. First, the rat needs to be anesthetized. We can use short-term anesthesia like inhalation and ether if we wanted to do non-terminal blood collection and collect small volumes. But we can use long-term anesthesia like uricane if it is terminal method. After anesthesia of the rat, the animal is held by the back of the neck and the loose skin of the head is tightened with the thumb and the middle finger so as to congest the eye veins. With a rotating motion, the tip of capillary tube is placed at the medial canthus of the eye through the conjunctiva membrane. Continue rotating of the tube, capillary tube, until blood flows. Blood will flow as soon as the sinus is punctured and the blood enters the capillary tube and comes out. At this moment, collect the blood into the test tube or the appropriate container you want. Here, if you collect a small volume, less than 10% of the total blood volume, this is non-terminal method and the animal will be released and recover. While if you collect more than 3 centimeters or more than 10% of total blood volume, the animal will die. So this is a terminal method. So the decision depends on this step, how much I collect blood. After finishing blood collection, release the animal and apply gentle pressure to stop bleeding. If non-terminal, collecting small volume, the animal will recover and return to its cage, while in terminal, the animal will die. The second method is cardiac puncture blood collection. It is a terminal method collecting single, good quality, large volume of blood. About 5 to 10 milliliter can be collected by this method. The blood is taken from the ventricle slowly so as to avoid collapsing of the heart. Steps of cardiac puncture blood collection: start by deeply anesthetize the rat, then place the rat on its back. Place your finger at the level of the lowest ribs without applying any pressure. Here, the heart is roughly 1 centimeter above this point and slightly to the right. Hold the syringe at 45-degree angle. Insert the needle slightly left off and under the sternum. Without moving the syringe, aspirate blood. Once the syringe is full, it is carefully disconnected from the needle and emptied into a tube after removing the needle. Empty the blood on the wall of the tube very gently. The syringe can then be reattached to collect more blood. During collection of blood or aspiration of blood, do this slowly so as to avoid collapsing the heart. After collecting blood sample, the rat should be immediately euthanized and relieved. The third method is decapitation trunk blood sampling. Decapitation can rapidly collect large volume of blood up to 10 milliliter in rat. But blood here is mixed venous and arterial from the anesthetized animal. So first we should anesthetize the animal. The head is removed with sharp scissors or scalpel. The neck is placed quickly over a collecting test tube. trunk blood is collected from the site where we decapitate the animal. The blood sample from this method, decapitation method, has a disadvantage of being contaminated with tissue fluids and hair. Tail vein blood collection. Tail vein sampling is suitable for small volume of blood. We can collect about 0.1 to 0.2 milliliter in rat. This is according to the size of the rat. It is a quick sample method, but it is very stressful and can deviate the results. Steps of tail vein blood collection. First, the animal should be restrained. Put the animal in a restrainer and clean the tail with alcohol. Warm animal tail with heat lamp or even massage so as to dilate and congest blood vessels so the tail vein can be accessed easily. Do finger pressure 5 centimeters from tail tip to enhance the visibility of the tail vein. The lateral tail vein is accessed 1/3 from the tail tip. Insert the butterfly needle or cannula needle to collect blood. Here, if you wanted to take just drop of blood, for example, in model of diabetes, we wanted to measure blood glucose frequently by using glucocheck apparatus, and we need just a drop of blood. In this method, we can use just a sterile scalpel each time we wanted to take just drop of blood. After taking blood sampling, if you wanted to repeat or take multiple blood samples, collect the blood from the distal end first and then move upward. Since taking the first samples from the proximal end of the tail can cause perivascular clot and inflammation, that will reduce blood flow in this area distal to the point I take the blood sample. So always move upward if you want to take multiple blood sampling. After collecting the blood, remove the needle and apply gentle pressure to stop bleeding for at least 30 seconds before the animal is returned to its cage. The fifth and the last method here is the saphenous vein blood collection. Saphenous vein runs dorsolateral over tarsal joint. It is relatively quick method of blood collection, but we collect only small amount of blood. The rat here may be need to be anesthetized. The site of blood collection should be first shaved. Then the rat should be restrained well. Then the hind limb is immobilized in the extended position. Then a puncture is made with a fine needle to collect blood. Number of trials here should never exceed 3 punctures in one attempt. After taking the blood sample, apply gentle pressure to stop bleeding for 30 seconds at least. Then return the animal to its cage. After collecting blood from any of the previously discussed 5 methods, we should prepare serum for biochemical research. How to prepare serum? Allow blood to clot by leaving it at room temperature for 30 to 60 minutes at least. After this period, remove the clot by centrifuging the blood in a centrifuge adjusted at 2000 3000 speed for 10 to 20 minutes at least. At the end of this centrifugation, use a micropipette to aspirate very gently the serum without touching the blood clot below. Collect the serum in Eppendorfs and store it at -20 or lower. What is the difference between serum and plasma, and why we collect serum usually in experimental research? Serum is the liquid part of the blood after coagulation. We leave the sample to coagulate, then centrifuge. So clotting factors not present here because it is consumed. So serum divide clotting factors as fibrinogen. While plasma, it is liquid cell-free part of the blood that has been treated with anticoagulants. So coagulation factor is present here. So we can say that serum equal plasma minus clotting factors or fibrinogen. This table summarizes the difference between serum and the plasma. First, to prepare serum, anticoagulants are not needed, while to prepare plasma, anticoagulants are needed, such as EDTA or heparin. In serum, we need to leave the sample for 30 to 60 minutes, while in plasma it can be prepared as soon as it has mixed thoroughly. In serum, fibrinogen and clotting factors is absent, while in plasma fibrinogen is present. Serum is a clear sample, depleted of cells and cell remnants, while plasma, there is platelet and cells, white blood cells especially, can contaminate the liquid fraction. In serum, potassium level and 5-HT level is higher than the normal or relative to its plasma value because of platelet retraction and platelet destruction will release potassium and 5-HT during the clotting process. While in plasma, there is no clotting. So, the level of potassium and 5-HT is normal. Generally, serum is considered more stable and the gold standard for biobanking, while plasma is considered less stable than serum. So serum is preferred over plasma in biomedical research.